I'm Jessie Everts. I'm Wayside's Vice President of Clinical Programs, and today I'm going to be doing our fraud, waste, and abuse compliance training. This is a training that's required by DHS, our state licensor, as well as the National Centers for Medicaid and Medicare services that we train staff on every year. So this is fraud, waste, and abuse compliance training. So this training you'll see in the PowerPoint slides. This is a pretty structured, decided by CMS, or Centers for Medicare and Medicaid Services. They have told us what we need to train staff on. So I'm going through their PowerPoint slides. So it's pretty important that you read the slides because that's what is the main core of the training. And then I'll add a little bit about kind of how this applies at Wayside as we go. So your responsibilities as working within a healthcare organization like Wayside is to prevent fraud, waste, and abuse from happening as much as you can. That means operating within our organization's ethical guidelines to prevent noncompliance. To detect and report fraud, waste, and abuse if you see it happening, either within Wayside or by a partner agency. So if you see something that might be noncompliance with fraud, waste, and abuse guidelines, make sure you report it. And then correct noncompliance. And that means if you see something that might not be in compliance, you make that report, then we need to do something to correct it, either correcting our policies or making sure that the practices that we're doing are in compliance with the fraud, waste, and abuse prevention guidelines. So the reason we want to correct noncompliance is that it protects clients and it saves money ultimately for Medicare and Medicaid. So, by educating ourselves on how to detect and prevent fraudulent activities, we can save unnecessary costs that would increase healthcare premiums and protect Medicare and Medicaid funds that are relied upon by millions. Most of our clients are covered under Medicare and Medicaid funds, and so this is making sure that we're really using those funds appropriately to make sure that they're still around for others to use. So what is fraud, waste, and abuse? Fraud, the first piece, is intentionally submitting false information to the government or government contractor in order to get money or a benefit. So this might be a healthcare provider intentionally submitting or causing someone else to submit false or misleading information to obtain medical payment or payment for services. So that might be claiming that a service happened that didn't, overcharging for something, any kind of intentional misuse of Medicare and Medicaid funds. Waste is overutilizing services or other practices that directly or indirectly result in unnecessary costs to the Medicare and Medicaid system. So that might be actions by an individual that cause the health plan to consistently pay for or authorize unnecessary services, healthcare spending that could be eliminated without reducing the quality of care, doing a lot of extra tests, extra things like that. Not criminally negligent, but rather the misuse of resources. So waste is not necessarily intentional, but might be just a misuse or inefficiency in the system that causes excessive utilization. And then abuse are actions that may be directly or indirectly result in unnecessary costs to the Medicare system. So that might be errors or improper actions that result in excessive, unreasonable, and unnecessary cost, payment for items or services when there's not legal entitlement to that payment, when the provider has not knowingly or intentionally misrepresented facts to obtain that payment. So again, abuse is not intentional, but it may be just errors or issues in practices. The differences between fraud, waste, and abuse, the primary differences are intent and knowledge. So fraud requires that you have intent to obtain payment and knowledge that the actions you're taking are wrong. Waste and abuse may involve improper payment, but they're not necessarily accompanied by the same intent or knowledge. So the same kind of practices may be happening, and whether or not it's fraud depends on whether or not it was intentional. So here's some things that can happen within a healthcare agency like ours. The first being mistakes. There may be just billing mistakes or payment mistakes or reporting mistakes that happen that result in errors in payment, and that could be things like incorrect coding, writing down the wrong diagnosis code or writing down the wrong UA results, things like that may result in errors, not necessarily fraud, waste, or abuse. If there are inefficiencies, that can result in waste, and an example of that would be ordering extra tests or offering lots of services to a client whether or not they're needed. And that would result in waste, as we talked about. So bending the rules, such as improper billing practices, can result in abuse, meaning charging for services that are not warranted, whether or not we have intention about that. And then intentional deception can result in fraud, and that example would be billing for services that were not provided. So fraud is a crime. Fraud's a crime when an individual intentionally submits or causes someone else to submit false or misleading information to obtain treatment or payment for services they're not entitled to. And because it's a crime, I think we'll talk a little bit about the fines that can result from the charge of fraud. Here's how we prevent fraud, waste, and abuse. First thing is we make sure that we're up to date with laws, regulations, and policies. That's why we do this training every year, to make sure that all of our staff are aware of the fraud, waste, and abuse reporting guidelines. Always verify information provided to you, so rather than just trusting what's on that piece of paper that comes from another agency, maybe we want to verify that those diagnosis codes are correct, or verify that what we're submitting to billing is correct, just making sure that we're being accurate in our billing. Be on the lookout for suspicious activity. If you're getting reports that something isn't right, or that somebody's changing some documentation somewhere, whether that's within Wayside or outside of Wayside, please always report that. Make sure that you coordinate with other payers or providers. We want to make sure that if our clients are seeing another healthcare provider for primary care, for therapy, that we're coordinating so that we're making sure that there's not overuse of funds happening between payers. And then making sure that data and billing is accurate and timely. This is why it's important for us on the clinical side of things to do our documentation in a timely manner so that we make sure that it's as correct and accurate as possible by the time it gets to billing, and then they process it as quickly as possible so that it's what is turned in and what is paid for is as accurate as possible. Here are the important laws around fraud, waste, and abuse that you can read through and look at more. We, of course, have another training on HIPAA, our Health Insurance Portability and Accountability Act, that you'll be watching, I think, biannually. We're required to offer that for staff. So these are all important laws that relate to fraud, waste, and abuse. So the consequences of committing fraud, waste, or abuse, the first one is penalties or fines, and they're pretty significant fines that can happen if fraud, especially intentional misuse of funds, can be shown to have happened. There can be criminal convictions, there can be prosecution, imprisonment, loss of our license or your license, and exclusion from federal health care programs, meaning we would not be able to take clients on Medicare and Medicaid. So who commits fraud? Any of the following could potentially commit healthcare fraud. Providers, such as ourselves, members or clients can commit fraud, pharmacies, pharmaceutical manufacturers, and employees of healthcare entities. So we'll give some examples of each of these. So for providers, some examples of fraud that might happen on the provider level would be unbundling or upcoding, meaning altering claims or medical documentation to get more payment for that. Billing for services that are not rendered or supplies that are not being provided. Prescribing drugs without reviewing a patient's condition or giving unnecessary medications would be something that can happen at medical facilities. And writing a prescription for a higher quantity than is appropriate to assist a member with minimizing their co-payments. So things like that are maybe well-intentioned, meaning you know that the client can't afford to pay this same co-payment in another week to come back. Still, writing a higher prescription or offering some services additionally can be seen as fraud. So some examples of an employer or patient fraud would be stealing a prescription pad and writing their own prescriptions, reselling drugs, using someone else's ID card to obtain health care benefits, modifying a prescription to add more refills or increase quantities. Things like that are things that clients themselves might do that are fraud. Pharmacy fraud examples, and this can come into play because we work with a lot of pharmacies, so if we see any of this happening, always let someone know. Billing for the full amount prescribed but only filling a portion, not crediting the difference back to the health plan, intentionally billing for a brand name product but dispensing a generic or using the wrong code, manipulating calculations to alter how much coverage beneficiaries qualify for, and prescription forging or altering. So here's some examples of fraud by pharmaceutical manufacturers. One would be offering inducements if the purchased products are reimbursable by any of the federal healthcare programs. So kind of pushing a certain thing because it's reimbursable. Promoting off-label drug usage illegally through marketing, financial incentives, or other promotion campaigns. and using free samples illegally by knowingly providing them to the physician who will bill the healthcare program for the samples. And then there are health insurance fraud that can happen, meaning the insurers themselves could commit fraud. That would be things like violating the healthcare marketing guidelines, offering beneficiaries a cash payment as an inducement to enroll, bait and switch pricing, luring customers by advertising a product or service at an unprofitably low price and then revealing that that product's not available, payment for prescriptions written by known or deceased physicians, misrepresenting or falsifying information to CMS. So again, there's a really fine line between fraud and abuse based on whether there's intent to deceive the healthcare industry or not. Fraud involves the conscious deception or misrepresentation intended to result in an unauthorized medical or pharmacy benefit. And abuse might be similar to fraud, except that it might not be probable that the abusive acts were done with intent to deceive. So if you can prove that the person knew they were committing a crime, it would be fraud. If not, it's most likely abuse. In either case, you should report it. So here are some kind of practices that health plans have in place to make sure that they are preventing fraud, waste, and abuse at all costs. They have to have a compliance program that includes 7 elements: written policies, procedures, and standards of conduct. They have to have a compliance officer, a compliance committee, and high-level oversight. They have to have effective training and education, effective lines of communication, well-publicized disciplinary standards, an effective system for monitoring for compliance, and procedures for response to compliance issues. So what you can do as an employee of Wayside is if you recognize activities that may constitute fraud, waste, or abuse committed by a provider, a pharmacy, a member or a client, a subcontractor, or employee, report those incidents as quickly as possible. So you can help prevent potential fraudulent activities by reporting suspected maltreatment or acts. Our internal procedure would be that you talk to your supervisor first to figure out how we can make those reports. So here's some reasons why you should make reports. 1, combating fraud helps lower healthcare costs and taxes. 2, we're required by CMS to report all suspicious activities. Reporting could essentially prevent someone from being victimized by fraudulent behavior and protects the integrity of the healthcare industry. Everyone has the right and responsibility to report possible fraud, waste, or abuse. And so the first thing you're going to do is report to your organization's compliance officer or compliance hotline. And we'll talk about who that is at Wayside here in a moment. And you may report anonymously, and retaliation is prohibited when you report a concern in good faith. So things that may come up here at Wayside that would be reportable in terms of fraud, waste, and abuse. If you have concerns that billing might not accurately reflect what services are being provided, if you've been instructed to record a service as something different than what's actually being offered, always report that. If we have knowledge that a client is doing something fraudulent with their benefits, we need to report that. If you believe that an insurance company or other provider that we're working with is doing something fraudulent, always report that as well. So you can have, if you have questions about any of those things or anything that you notice happening, whether or not it's fraud, waste, or abuse, you can first consult with your supervisor or inform our compliance officers, which are myself, Christy Olson, and Karina Forrest Perkins, our CEO. And we will help, in that case, if we get a report, to develop a corrective action plan, meaning looking at what needs to be changed to make sure that that doesn't happen again. That is the end of the required training by CMS. So if you have any questions, please talk to your supervisor or myself or any of those compliance officers that were listed there. Thank you.